Assalamu alaikum. Today I'm going to read AKP clinical case number 17, that is, a teenage girl who took some tablets. 15 years old girl present to the emergency department at 4 pm with nausea and vomiting. She says that at 8 am that morning she had taken 20 adult paracetamol tablets. Each tablet is typically 500 mg. This is a case of deliberate self poisoning, which is confirmed by her history of depressive thoughts and suicidal ideation shared on social media over the past 6 months. Her vital signs: heart rate 110 beats per minute, that is tachycardia. Respiratory rate is 23 breaths per minute. Blood pressure is 115 by 85, is normal. This patient is conscious and alert, and her physical examination is normal. Laboratory tests, including full blood count, electrolytes, liver functions, all are normal. Paracetamol plasma concentration is 105 mg per liter. This level is reported after several hours have passed since ingestion. Let's now understand first what happened after ingesting paracetamol. When someone takes too much paracetamol, their body struggles to process it safely. Paracetamol is usually metabolized in the liver, which is the body's detox center. Under normal conditions, most of the paracetamol, around 90%, is turned into harmless substances by attaching it to sulfate and glucuronide, like labeling it for disposal. About 10% is converted into a toxic byproduct called NAPQI or N-acetyl P-benzoquinone imine. Normally, this toxin is handled quickly by a natural liver chemical called glutathione, which neutralizes it. But here is the problem. When too much paracetamol is ingested, the usual pathway sulfate and glucuronide get overwhelmed. This means a lot more paracetamol gets turned into the toxic byproduct NAPQI. The body's stores of glutathione get used up quickly because there is too much NAPQI to handle. Without glutathione, the toxic NAPQI builds up in the liver and starts damaging liver cells. This is what causes hepatocellular necrosis, that is, death of liver cells. Let's apply this to the case the girl took 20 adult paracetamol tablets at 8 am. By the time she came to the hospital at 4 pm, it had already been 8 hours since ingestion. Why is timing important? Because in the first few hours after ingestion, paracetamol is still being absorbed into the bloodstream and metabolized. The toxic effects on the liver typically starts within 8 to 24 hours, but the damage can peak 2 to 4 days later. This gives us a golden window in which we can stop the damage from happening. If treatment is started within 8 hours, we can often prevent serious harm to the liver. After this period, the risk of permanent liver damage or liver failure increases. To measure the plasma concentration of paracetamol in the blood, we have to compare the level of paracetamol in the blood to compare with the chart called Rumack-Matthew nomogram, which helps us to determine if the level is high enough to require treatment. For this patient, her blood test showed a paracetamol level of 105 mg per liter. Based on the nomogram, this level crosses the treatment line, meaning she is at risk of significant liver damage and needs immediate treatment. Let's solve the question which is given in this case. Number 1. Which of the following is the most appropriate action at this stage? Select one answer only. Let's rule out other options. A. Administration of activated charcoal. This is effective if given within 1 hour of ingestion, as it prevents absorption of paracetamol in the gastrointestinal tract. In this case, the ingestion occurred 8 hours earlier, so activated charcoal would be ineffective. Next option, admit, observe and repeat an examination of the paracetamol level in 4 hours. This delays treatment unnecessarily if the paracetamol level crosses the treatment line. Number third option is gastric lavage. Like activated charcoal, this is only useful within 1 hour of ingestion. Beyond this time frame, it does not reduce toxicity significantly. So it's wrong. Next option is refer for hemodialysis. Hemodialysis is only indicated in severe cases such as acute liver failure, renal failure, or very high paracetamol levels that are not responding to acetylcysteine. This patient does not meet these criteria yet. So the correct answer is IV acetylcysteine. The antidote for paracetamol poisoning is IV acetylcysteine, and it's highly effective if given within the first 8 hours. After an overdose, here is how it works. First, by replenishes glutathione. Acetylcysteine acts as a substitute or booster for glutathione. It helps the liver neutralize the toxic NAPQI and prevent it from causing further liver damage. Number 2, by minimizes liver damage. If given early enough, acetylcysteine can reduce the risk of serious liver injury even if started later. It can still help by limiting the progression of damage. Number 3, prevent acute liver failure. By stopping the buildup of toxins, acetylcysteine significantly reduce the chances of the patient developing acute liver failure, which could otherwise lead to the need for a liver transplant. Here is the second question. Which of the following is the most frequent serious complication of paracetamol poisoning? Select one answer only. Let's rule out one by one. Number 1 option, cerebral edema. This is the late complication of acute liver failure. Next option is gastric hemorrhage. Gastric hemorrhage rarely occurs with paracetamol poisoning. It is more associated with NSAIDs overdose or other toxins causing gastrointestinal irritation. Next option is hypoglycemia. While hypoglycemia can occur as a result of liver failure, it is a secondary complication rather than the primary or most frequent one. Next option is renal tubular necrosis. It can occur in severe paracetamol toxicity, but it is less common than liver damage. So the correct answer is hepatic necrosis. Hepatic necrosis is most severe and common complication of paracetamol overdose, which can lead to acute liver failure, hypoglycemia, and cerebral edema, and renal failure and coagulopathy in advanced cases. This is all about from this case. If you have any question regarding this case, comment below, like, subscribe, and share.